Hello, my name is Daniel, a clinical trainer from DubiMed. Today I want to introduce to you our latest addition to our machines profile called Sofwave. Sofwave is made in the United States and FDA approved. Sofwave is using ultrasound technology, specifically Superb technology, which is a patented technology for the company which they invented for this machine. Superb stands for Synchronous Ultrasound Parallel Beam. Now, the difference between Superb technology and any other HIFO machine is that in Superb technology, you have 7 parallel cylinders that they are releasing energy all at the same time. The depth of this cylinder is going to be from 0.5 to 2 millimeter, but the focal point in the center is going to be 1.5. The epidermis is completely protected, first of all, because of the horizontal manner of shooting, and secondly, because the handpiece has active cooling. It's called soft cool. At all the time is keeping the skin from 15 to 25 degrees Celsius. Now, we are not going deeper than 1.5 because most of the new collagenesis is happening in mid-dermis at the depth of roughly 1.5 millimeter. So there is no need to go deeper because we want to reduce the chances of damaging facial fat or creating fibrotic tissue under the skin. The machine has energy of 3 joule all the way to 5 joule, which you can choose according to your indication. There are no consumables, physical consumables for the machine, except the shots that should be purchased through the company online. Sofwave has FDA clearance for wrinkles in submental area, neck, and also eyebrow. So overall is one of the best treatments for treating lax skin, deep wrinkles around the neck, around the eyes, and eyebrow lift. It's a non-invasive treatment, so there is no specific pre or post care. There is only 1 session per year, and after that the patient can go about their lifestyle with no issue. Please note, even at the lowest energy, which is 3 joule, still you are able to reach around 62 degrees Celsius, which is enough for new collagenesis. The range of frequency in this machine is from 10 to 12 megahertz. Now in this video, I'm going to show you how to turn on the machine, how to set it up, to dial in your parameter, draw the no-fly zones on the face of the patient, and also how to do the treatment step by step. So I will show you the no-fly zones for Sofwave treatment. Firstly, we'll start in the center of the forehead, around 2 centimeters in the middle, then just above crow's foot, also cover the nasolabial. Also, we have to avoid a thyroid gland, so below the ear. And let's conclude the no-fly zones. So now I want to show you how to set up the machine for the treatment. The first thing, there is a power button just below the machine that you have to make sure that is on. Then you can turn on the machine by this key. This would be your safety key. Make sure it's not pushed inside. In the case of emergency, you can push this in, so automatically the power is going to cut. Make sure this handle, as you can see, it's always pushed down. This is to ensure that the connection is secure. Then we can press the key. It's going to take a couple of minutes for the machine to boot up, and that's because the machine needs to cool the handpiece. So after the machine boots up completely, you are going to be welcomed with this page. So starting from here, this is your pulse duration, which is 5 seconds. This is not adjustable, so all of the shots are fixed at 5 seconds. The second one is going to be the energy. The lowest energy is going to be 3 joule. Even at 3 joule, you are going to reach 64 degrees Celsius under the skin, so new collagenesis is going to happen. So if your patient by any chance cannot take higher energy, even you are working at 3.0 joules, still you will get the full results for the patient. The last section is for post-cooling. Automatically you have 1 second of post-cooling. You can increase it up to 3 seconds if the patient needs it. This section you can create intervals and keep your hands or your foot either on the foot pedal or on the key here. So the machine is going to shoot automatically, and this number is going to indicate the interval between the shots. Or you can turn it off to keep it as single. In this section, you can see the remaining shots that you have in your machine. In order to renew or refill the shots, after purchasing the shot, you will receive a code that you have to enter the code in the machine, which I will show you how later. And you can see the number increases according to number of the shots that you purchased. This is our handpiece, as you can see. This area is the active area that the shot takes place. It's around 25 millimeters. These are the transducers, 7 transducers that all of them are working all at the same time, parallel. Now you have to make sure before you start the treatment, the whole area and the handpiece is completely clean with isopropyl, and there is no residue of gel from previous treatments. This would be our action key. We have to hold this till the machine releases the shot completely. We can see the feedback on this light that's going to blink. That indicates that the shot is completely done and safe to remove your hands. The tip is going to be cold at all time from 15 to 25 degrees Celsius in the skin. An important point is never shoot with the activated tip in the air or anywhere else but the skin. It's very important because sometimes if you do that, might be resulting breaking these transducers. I'm starting the treatment. First, I have to press on standby. It's going to take about a minute. It's going to keep the handpiece cold. As you can see, it's rotating. This is my shots remaining. This is the energy I want to start initially, and I keep the post-cooling as 1 second as default. Now here you can have different areas because it's very important to work in a symmetrical manner. So in this way we can know exactly how many shots we are implementing in each area. For this treatment we have to use ultrasound gel, and make sure your ultrasound gel is clear. Do not use any colored ultrasound gel. So I like to start with the cheek area as area 1. Then the right side neck is going to be area 2, and then the right side forehead area 3. Then following with area 4, 5, and 6. Now, the rotation of these areas does not matter really. You can rotate it as any way you want. So, I want to distribute my shots in columns. So, every shot is going to be in this manner, and the overlap from one to the second is going to be 10%. So for the cheek area, I'm going to do 50 shots, and I will work in columns like this. So every shot is going to have 10% overlap from the previous. After I'm done with the full column, next column is going to have 50% overlap with the previous column in this manner. I prefer to use foot pedal. If you prefer the key over here, also you can use it. Let's start with the first shot. After you hear the feedback from the machine, means the shot is done, so you can move your hands. 10% overlap. can also concentrate on nasolabial fold. So I'm done with the first pass. For the second pass, I can go vertical. Well, this is not a must, but it's really good for better distribution of shots and volumetric heating of the area. So one of the safety features that the machine has for the curvy areas, especially forehead, if in case you cannot land the handpiece completely over the area, and if the machine senses that one or more of these transducers are not in complete contact with the area, the machine is going to prevent the shots from happening. So I'm gonna do another 50 shots for the neck area. This includes the neck and also the right side of the double chin. Same manner that we worked on the face, we are going to go exactly the same. So 10% this way, and when we go to the next column, is going to be 50% overlap. So we are going to apply the gel. We want the thick layer in the area that we want to work. After the treatment is done, it's very important to clean the tip completely and get rid of all the residues of gel to keep it always clean, because if you leave it on, later on this dried gel can damage the handpiece itself. Now we know each area exactly how many shots. As you can see, it's completely symmetrical. This would be the right side cheek, right side neck, right side eyebrow, again left side cheek, left side neck, and left side eyebrow. And we can get an estimate how much energy we implemented in each side exactly. And that's about it.